Good morning, my lovely people. Let me hope each one of us is fine. Personally, I'm good, I'm healthy, and I always thank my God for that. We are still looking about kidney failure, and today we will be discussing about the diagnosis, or how will a doctor diagnose or tell that someone is having a chronic kidney failure. But before we continue, you are there watching this channel for the first time, why can't you just subscribe, which is very free? No charges for subscribing, no charges for liking, and also sharing the video with other people so that they may benefit from this education. I've heard so many people appreciating my work, people appreciating the lessons they are getting from this channel, because most of these diseases are all over. So let's continue supporting this channel so that it may grow to greater heights. For the returning subscribers, I always appreciate you people, because this channel is where it is at the moment because of your support. Let's continue sharing with our brothers and sisters, and I'm sure this channel will grow to greater heights. Diagnosis of chronic kidney failure. And the first way you can diagnose is through a physical exam or physical examination. At your appointment, your doctor will perform a physical examination. At your appointment, the doctor will perform a physical examination. Kidney failure can cause fluids to back up in your legs or heart. Kidney failure can cause fluids to build back up in your legs or hands. A doctor may examine these organs by listening to them with a stethoscope. At your appointment, a doctor will perform a physical examination. Kidney failure can cause fluids to back up in your legs and heart. A doctor may examine these organs by listening to them with a stethoscope. Number 2, blood and urine tests. Blood and urine tests. If a doctor thinks you might have chronic kidney failure, they will likely order blood and urine tests. Blood and urine tests. If a doctor thinks you might have chronic kidney failure, they will likely order blood and urine tests. Blood tests for kidney function measure levels of electrolytes and wastes in your blood. Remember that when your kidneys are not functioning, there will be accumulation of wastes in your blood. That's why we are saying blood tests for kidney function measure the levels of electrolytes and wastes in your blood. They measure waste products such as, number 1, creatinine, which is a product of muscle metabolism. Number 2, blood urea. Blood urea, which is a leftover when your body breaks down proteins. So we always get urea after the breakdown of proteins. We can say that urea is a byproduct of protein breakdown. Blood tests for kidney function measure levels of electrolytes and waste in your blood. They measure waste products such as creatinine, which is a product of muscle metabolism. Number 2, blood urea, which is a leftover when your body breaks down proteins. A point to note: when your kidneys are working properly, or when they are normal, they excrete these substances. Which substances? Urea and creatinine. When your kidneys are working properly, they excrete these substances. Urine tests can measure your kidney function. Urine tests can measure your kidney function. A urine protein test measures how much protein is in your urine. Let me repeat this again. When your kidneys are working properly, they excrete these substances. Urine tests can measure your kidney function, so that you may know if your kidneys are functioning well or they might be having a problem. A urine protein test measures how much protein is in your urine. This is self-explanatory. It doesn't need any explanation at all that a urine protein test measures how much protein is in your urine. Urine typically contains only trace amounts of protein. Urine typically contains only trace amounts of proteins. An elevated protein level may indicate problems months or even years before the symptoms appear. Urine typically contains only trace amounts of protein. An elevated protein level may indicate problems months or even years before other symptoms appear. Imaging tests. This is the third way you can diagnose. We have discussed about physical examination, blood urea. And now we'll be looking at imaging tests. Imaging tests can provide structural details of your kidneys. Imaging tests can provide structural details of your kidneys. These include the following. Number 1, kidney ultrasound. We have magnetic resonance, and we have CT scan. Imaging tests can provide structural disease, let me repeat this again. Imaging tests can provide structural details of your kidneys, and these include number 1, kidney ultrasound, number 2, MRI, number 3, CT scan. Number 4, the third way you can diagnose is by biopsy. The doctor may order biopsy, for example, needle biopsy or open biopsy. The doctor may order biopsy, needle biopsy, or an open biopsy. Let me repeat that again. Doctor may order biopsy, for example, needle biopsy or open biopsy. Needle biopsy is the most common used type of kidney biopsy. Needle biopsy is the most common used type of kidney biopsy. A doctor inserts a needle in your kidney. This is considered a minimally invasive procedure. Needle biopsy is the most common used type of kidney biopsy. A doctor inserts a needle in your kidney. This is considered a minimally invasive procedure. In open biopsy, the doctor uses surgical incision to expose your kidneys, and it requires a general anesthesia and sterile techniques. Needle biopsy is the most common used type of kidney biopsy. A doctor inserts a needle in your kidney, and this is considered a minimally invasive procedure. In open biopsy, doctors uses surgical incision to expose your kidneys, and this requires a general anesthesia and sterile techniques. This brings up to the end of this video. Thank you for supporting this channel. Let's continue liking, sharing, and commenting on our videos so that this channel might be recommended all over in the world, and you will continue enjoying this educational bangers each and every day. Let's have a fine day ahead.